Hello, everyone, and thanks for joining us today. My name is Jason Lotzner, and I'd like to welcome you all on behalf of Blue Cross Blue Shield of North Dakota to the Availity Provider Portal webinar. A few housekeeping items before we get started today. Everybody will be on mute during the webinar, but you'll be able to ask questions at any time. So if you look at the GoToWebinar panel, you'll see a tab where you can type your questions, and at the end of the presentation, we'll answer as many as possible. Thanks again for joining us today, and you can take it away from here, Ryan.
Good morning, everyone. My name is Ryan Slominski. I'm the team lead of our EDI Business Operations Department here at Blue Cross Blue Shield of North Dakota. And I just want to start by saying thanks for joining us this morning as we talk about the Availity Provider Portal and some tips and tricks on things that you can do now, as well as some new features that we're excited to roll out to you guys. So as we take a quick look at the agenda here, as you can see, we're going to start by going over some tips and tricks on some of the existing features, including eligibility and benefit inquiry, claim submission, claim status inquiry, remittance viewer, and referrals. Then we'll get into a couple of new features that we're excited to tell you about, those features being prior authorizations and the direct messaging feature. From there, we'll go into some resources at your disposal for learning and support with the portal, and then we will wrap it up with a Q&A session. Before we get too far into it, in addition to the disclaimer on the screen here, I should also make sure to note that the screenshots in today's webinar were taken from our test and QA environments. So none of the data on the screen will be legitimate actual data. It's all made up test and dummy information. And in addition to myself, we have a couple of other members from our EDI business operations team on today. So a little later on in the webinar, you will be hearing from Barbara Horton about referral and prior authorizations. And then Lucas Fatland will be closing our show today to talk about direct messaging as well as some learning and support resources. Okay, so let's get into the portal. As you can see up on the screen is the Availity login page. I'm sure at this point you've seen it a few times already. Wanted to make sure to get the URL out there for anyone who doesn't have it. So to get to the site, you would just go to apps.availity.com. And then as you can see on the screen here, also gives you the option to reset your password if you need that. And it will also email you your user ID if you should forget that. So the first transaction that we are going to take a look at this morning is eligibility and benefits inquiry, which is just a way for users to be able to look up eligibility and benefit information for a member, whether that member is from North Dakota or out of state. You can do for either one. The first tip we have for you on this transaction is to let you know that the subscriber ID is no longer required on this if it's a local member. So if you have a North Dakota member in front of you who doesn't have their card and you want to look them up, you can do that by using the member's first name, last name, and date of birth. We got a lot of requests for that, so we were happy to be able to implement that. Again, it does have to be an in-state member in order to use that. The next tip we have for you is to make sure to remember to use the billing provider or facility NPI and not the rendering provider NPI. We do see some transactions fail on this every now and then, so we want to make sure to point that out for you. The next and probably most important thing we have to tell you about this transaction is the use of specialty types. So we'll show you a screenshot in a second here, but the portal does allow you to specify a specialty type for your eligibility request. If you choose that, it provides extra information on that specialty for you. So for example, if I was doing a E&B inquiry because I needed to run a therapy service for a subscriber, I can specify that I'm looking for occupational therapy, for example, and it'll come back with extra information, including like how many visits the members have left or something like that. Lastly, just want to make sure to point out on this transaction and many other ones in the portal, there's always a demo available from the screen that you're entering the transaction on. So we'll show you that too here. This is where you would actually enter the eligibility and benefit transaction. As you can see, pretty self-explanatory, nothing too complex. Um, you would start by choosing your payer, which would be in this case North Dakota. It'll allow you to either enter your NPI manually or choose it from a drop-down if you have it saved. And then underneath that, you have the as of date, but then you have the benefit service type box, which is where we mentioned you would enter that specialty code. So if you wanted to go above and beyond just basic information, this is where you would click that drop down and it allows you to choose from a large list of specialties. Next, under patient search option, this is where you specify what you want to search by. So the default includes the patient ID and last and first name and date of birth. But if you want to search without the patient ID, if you don't have that, you can just click that little drop down and choose last name, first name, date of birth. And it will allow you to search with just that information. So here we have the results page for the E&B search. Again, this is a test environment, so the data that does display here is dummy data. The other thing I want to point out is that on this test environment screenshot, you don't see the member ID. You will obviously see that in production when you run a transaction. So as you can see up at the top, it has the information you searched for. It also has the plan coverage date. So if you want to know the effective date for a member that you searched for, it'll give you that right there at the top. And then at the bottom half of the screen is where it gives you the eligibility and benefit information. So, your copays, your deductibles. If you did enter a specialty type, you'll also see all of that information as you scroll down the screen. The next functionality we're going to take a look at is electronic claim submission. And so, obviously, most of the claims that you send to Blue Cross of North Dakota, you're probably sending to us through a software that you have at your facility. This offers an alternate method in case you need it. We see this often used for like secondary or tertiary payer claims. The reason being that the portal gives you a place to put in the information from the primary payer EOB. In addition to that, we also see this used a lot for corrected claims. So if you find you have to do a corrected claim, you would enter the information as you normally would, but then it also specifies where you can put the primary claim control number, things like that. So this is just a quick screenshot of what the claims entry screen looks like. It's a pretty long page, so we don't have the whole thing here, but it's just, as you can see, pretty user-friendly. It'll walk you through field by field what you would want to send to us on a claim. The next functionality that we're going to take a look at is claim status inquiry, which allows you to electronically search for the status of a claim that you've sent us, and it'll tell you whether or not it is paid, denied, or still in process. It doesn't have to be finalized in order to show up in your results. This tool does allow you to get multiple claims back at once in your search results. So if you want to view claims over a span of time for a member, you can put a date span in the date of service field and you'll see everything you have for that period of time. The next tip I can give you is when you do your initial search for a claim, it's best to start with just the basic information that you're required to send. So NPI, patient ID, patient name, date of birth, and date of service. There are other optional fields you can use to narrow your results down, but what we see is occasionally people will accidentally filter out what they're looking for if they put too much information in. So it's good to start with the basics and then add on from there. Again, you want to remember to use your billing provider NPI, not the rendering provider NPI. And with this tool, it does tell you if a claim is paid, denied, or in process, and it will give you some extra information. However, if you're looking for a full-blown explanation of benefits, the best tool to use for that is Remittance Viewer. So that's one thing to keep in mind is that if you're looking for things like adjustments and how much was paid on each line, the Remittance Viewer is probably a better tool for that, whereas the focus of this is to tell you the current status of the claim. And lastly, once again, there is a demo available that you can get to from the entry screen. So here we just have a quick look at the entry screen for a claim status inquiry transaction. As you can see, like we mentioned, NPI, patient ID, patient name, and date of birth. There are some optional fields spread out among this, and then you have your service dates there, as well as some other information below that. Here we have the results page for claim status inquiry. So you can see at the top, there's the information you searched for. On the left are the multiple claims that came back So each one of those boxes on the left is a claim. It's got a green line on it. There is some sort of payment on it. If it's red, it was all denied. And then if you had a claim that was still in process, you would see a yellow line there. As you can see in the middle of the screen, a lot of information, including claim number, process date, payment, as well as the check number and check date that are there. And then it will break down each line in terms of how much was paid on that. In the middle of the screen, you also have a link to Remittance Viewer. So as we mentioned, if you were looking for a full-blown remit with adjustment reason codes and denial reasons and things like that, this Remittance Viewer link here is where you would go. So you would just grab the claim number from your screen here and click Remittance Viewer, and then that'll allow you to search for a remit. So with that, let's take a look at Remit Viewer. This is a great tool that Availity offers. It allows you to look up remittance advice online, whether they be for payment or for a take back or recovery. When you look up these remits and print them out and view them, you can print them out as whole remits, but it also allows you to print out single claim information in case you need to forward anything on to a secondary. All of the remits that we have back to July 2018 are available to find on this portal. So there's a lot of great information here. And to search by that information, you have a lot of options to use. That's one of the great parts about this tool. You can look by check number, you can look by provider information, NPI or tax ID. You can use a claim number. You can even use member information. So a lot of ways to find what you're looking for. And again, like most transactions, there is a demo available as well. So we'll look at a few Remittance Viewer screenshots here. So this first screenshot out of our test environment is the check search results screen. So you can search by either check level data or claim level data. What we're looking at here is the results from a check search. As you can see, it gives you your search results on the screen there. To get into any of the remits, to dig further into it, if you look at the check EFT number, that's a hyperlink. That'll take you further into the check. There's also a set of icons on the right. The very last icon on the right there is the one you would click if you wanted to download a copy to your machine. So it'll download that PDF for you if you'd like. And then as you can see on the left, there are some filters you can use too. If you have access to more than one organization and Availity, you can filter using that, as well as check amount and date of the remit. And as we mentioned, you can also search by claim information. So this is the results of a claim information search. So same kind of look and feel to it again. Gives you your results there on the bottom right. This time to get into the information, the hyperlink's on the claim number in blue there. So if you wanted to take a look at a claim, that's what you would click. And then on the left, you have even more filters to work with. We kind of ran out of room on our screenshot here, but you can filter by organization, patient name, check amount. Further down on the screen, it even allows you to filter by things like adjustment reason codes and denials or payments. So there's a lot of great ways to organize and search for this data. And then we have our last Remittance Viewer screenshot, which is what you'll see when you click into a claim. So as you can see here, it gives you the provider information. It then goes down into claim information, claim number, member information, but then it's going to break down the payment and any adjustments. So it starts at a claim level, and then any service lines you have on a claim, it'll go into those one by one. So as you can see at the bottom of our screenshot here, it breaks down on that first service line the payment as well as the adjustment codes for that service line. So any adjustment codes or denial codes or reasons that you have on a service line, those are always going to show up in this tool as well. So with that, we'll move on to referrals and authorizations and hand it over to Barb.
Thank you, Ryan. I'm just going to briefly go over some functions related to referrals and authorizations here. First off is the ability to enter, search, and track your referral submissions through the portal. This allows an alternative to faxing information in and confirmation that your information has been received. You can search for referrals submitted both from and to your facility using the inquiry feature. and all Availity users within your organization can see referrals submitted by others on behalf of your organization through their dashboard. This is the first screen of the 4-page referral wizard that'll walk you through the information needed to submit a referral. First page is patient data and requesting provider data. Next would be the service state range that you're requesting and the patient's diagnosis. The third page will be where you enter the rendering provider information, or the provider that the patient is being referred to. And then the last page is a review and submit page. Once you hit submit, the referrals are automatically approved and no documentation is needed. One of the newer features we've added is the ability to enter, search, and track your authorization requests. This also allows an alternative to faxing and confirmation that your request has been received, as well as the current status of the request. Faster turnaround times on decisions and overall efficiency is improved by eliminating duplication of efforts and faxes not being received. Like referrals, all users within your organization can also see authorizations requested by others on behalf of your organization through their dashboard. You may also update authorizations to include additional documentation, update discharge information, and request concurrent reviews, not only for those requests that you enter, but also those that others in your organization may have entered as well. This feature can currently be used for all members except for out-of-state FEP members. This is the first page of the authorization request wizard. You'll see it's very similar to the referrals wizard. It will walk you through entering all of the same information that you would enter on a faxed request. There is an eligibility check that's done after this first page is entered to ensure that the member data entered is accurate. And you may notice, if you already use this feature for Minnesota, that entry of provider information is a little bit different on ours. Unlike referrals, most authorization requests will require supporting documentation and a review for determination by our staff. On the review and submit page, you'll see a certification reference number. You'll want to make sure to review the note that is returned after you complete your review and submit. You'll likely get a message prompt to attach clinical documentation. At this point, the request is still incomplete until that documentation is uploaded. Our staff cannot see your request until it's complete. You'll accept the SSO redirect to access an upload wizard, which will bring up a new page, and on that page you'll browse to the file on your computer and attach supporting documentation. Once attached, your authorization request will be in pending review status for our staff to make a determination. In some instances, though, you may get an approval message right away with no prompt to attach anything. This just means that the authorization does not need any review and does not require documentation for approval. Here is a snapshot of the dashboard that I mentioned earlier. A real-time status of all your referral and authorization requests are visible at a quick glance through this dashboard. Now, just a couple quick notes on statuses here. An incomplete status is one that's awaiting documentation to be attached. And once again, our staff cannot see those requests until they are completed. A pending review status is seen on a successful completed request that is awaiting review by our utilization management team. And a pending action status is one that's been initially reviewed and our team needs additional information from you in order to make their determination. Details on any authorization, including any notes that our staff has provided to support the decision, are available by clicking into that auth or by clicking on View Details under the View Action menu. You can request an update to add documentation, discharge information, or to make a concurrent review request, either directly from the dashboard or from the details page. And this is a snapshot of the inquiry screen. Inquiry will search and return referrals or authorization requests, whether they were submitted through the portal or via fax. You can also pin certain requests that you want to keep an eye on to your dashboard and have them readily visible without having to inquire on them each time. In order to do this, you'll either click the star under View Action on the dashboard or click Follow this item from the details screen. Now, each of these features, referrals, authorizations, inquiry, and dashboard, are available through the Patient Registration tab, Authorizations, and Referrals. Our next presenter is Lucas Fatland to review direct messaging and some other resources. Lucas?
And now I'd like to introduce the second of our two newest features, direct messaging. This was another feature that providers have been asking for, so we are happy to use that feedback to be able to provide this feature and offer a new, efficient way for providers to communicate with us. Direct messaging just went live last month in August, but we've already noticed a few of you have found this new feature and have been using it and have provided us with positive feedback. Direct messaging is a new way to reach the same customer contact center that you already work with. However, you can now ask your questions electronically through the Availity Provider Portal rather than over the phone. This means that, for example, if you only have a few minutes before you have to run to lunch for the day, you're able to log in, submit your question, and then later in the day when you have time, you can come back to the portal and get your answer. Users can log in and send questions 24/7. This functionality is connected to the eligibility and benefits and claim status transactions. The results page for those transactions is where you initiate a message. Because it's connected to those transactions, most, if not all, of the key info for your question will be forwarded to our customer contact center along with the question you send. Users are also able to attach and upload documents, including supporting medical documentation that we've requested for a claim. This means that if you receive a request for documentation from us on a claim, instead of faxing it to us, you can go to the Availity portal, run a claim status request for the claim in question, and then send us a message with the required medical documentation included. Please note that if you do this, you need to make sure that the request letter or cover letter is the first page in the attachment. Conversations, or questions and answers, are saved indefinitely on the portal and are visible by other users in the organization, so they can be used later on as a reference. What you're now looking at is the result page from an eligibility and benefit transaction, which we went over earlier. Please note the button that is boxed in red on the top right. This is the button to click if you'd like to send us a message. The pop-up on the right is where you choose your category for your question, type the question, and then attach any documents that you'd like to upload. Please note that the pop-up says to allow 2 business days or less for a response. However, the average turnaround time is currently about half of a business day. After you've sent us a message and you'd like to check the status of it or read the answer we've given, you can go to the messaging application. This screenshot is the page you see when you first log into Availity. Some of the icons and messages will be different, as this was taken from a demo environment. However, the messaging application will always be on the top right. To see the messages that have already been created and sent, click any of the hyperlinks highlighted in the red box. This is the view from within the messaging application. You'd only come here after sending the message. You cannot create a message within this application. To create and send messages, you must first either run an eligibility and benefits or claim status transaction and get to the results page. You can come here to the messaging app afterward to read the feedback provided by the Blue Cross Blue Shield North Dakota Customer Contact Center. This is also the screen where users would go in order to view the answer to previous questions they've submitted or to view questions that have been submitted by other members of their organization. The list of conversations will be on the left underneath the search options and will by default show the most recent conversations. To filter or search, you'd use the search and filter options on the left side of the screen. On the right side of the screen, the upper half contains the information that came in on the eligibility and benefits or claim status inquiry. The bottom half of the screen contains the question that was submitted, as well as any feedback or answers provided by Blue Cross Blue Shield of North Dakota. We'd like to finish up by going over a few learning and informational resources for providers. Payer Spaces is another brand new feature. It is a page within the Availity portal that is designed to provide news, training, links, and other resources specifically for BCBS-ND providers. To get there, you go to the Payer Spaces dropdown at the top of the page, boxed here in red, and then click the BCBS-ND icon. This is a look at the BCBS-ND Payer Spaces page on the Availity Provider Portal. There are some items out there already, with more to come. Under the Resources, you can see there are links to training for each feature in the Availity portal. Under the News and Announcements tab, you'll find news items as well as links to healthcare news articles. The Availity Learning Center is a resource provided by Avallity that offers detailed, step-by-step video training courses and walkthroughs for all the features in the Availity Provider Portal. You can access the Learning Center by going to the Help and Training dropdown in the top right, boxed here in red, and then by clicking Get Trained. Here's a screenshot of the Availity Learning Center. This page features trainings for all of the different payers that utilize the Availity platform. So if there are any other payers you use with Availity, you can search for their trainings here as well. To find a training, go up to the Search Catalog item at the top and type in the topic that you're looking to learn more about. For any questions you may have when it comes to registration or navigation of the provider portal, Availity Client Services is available to help. They can be reached at 1-800-282-4548. When reaching out to them, please have your Availity customer ID and your username ready to be helped as quickly and efficiently as possible.
Thanks for that, Lucas, and thank you, Ryan, Barb, and Lucas, all of you, for the content that you provided today. We're going to open it up for questions now. If anybody has any questions, please, I'm going to remind you to type those into the questions panel there. We've had a few great ones that have come in so far. So I think we'll get started right in on those. One thing I'd like to mention is that after this webinar, this will be shared. We have recorded the webinar. So if there's parts that you'd like to review or go back to at any point in time, those certainly will be available as a video online. And anybody that's signed up and registered today, we'll be sending that out so you can view that at a later time and go back and view any of the content from the presenters today. Without further ado, then I guess we'll get started in on questions. I'm going to just do a quick sound check to make sure we have all our presenters back. Ryan, are you there?
Yes, sir.
And Barb, are you there still?
I certainly am.
Hello, and Lucas and Cinda, are you both there?
I'm here.
Also.
Awesome. So we've got a few great questions that have come in. So the first one I'm going to ask is for Ryan, and the question is, can I submit appeals in the portal?
Yeah, it's a great question. So at the moment today, it's not available. However, that's definitely one of the items on our roadmap. Including, so like appeals, for example. I know another one that we hear about every now and then is the ability to search by procedure code and check whether or not prior auth is required using the portal. And then there's some things with attachments too. But yeah, so it's things like that. While they're not available, like right now at this moment, they're definitely on the roadmap. I don't have an exact date to say, hey, on this day and time, you'll be able to just have at it by any means. But it's that kind of stuff that we're working on. And webinars like this and the survey that you'll get after this and the surveys that have gone out, to be honest, are where we hear a lot about what providers would like to have added. So those are the three that we're really kind of focusing on. However, in the surveys that you do get, like I mentioned, that's kind of how we prioritize these things. So any other stuff you're looking for, any feedback you have, certainly be welcome.
Great. And thanks for bringing up that survey, Ryan. For everybody that's still on the call with us in the webinar here, we will be sending out a survey right when the webinar closes here, and then you'll be getting a follow-up email as well, and there will be that same survey link in there. So any feedback, recommendations, follow-up that you can provide to us can only make the experience better. So we encourage you to take that survey when you see it. The next question I have here is for Barb. I already have an Availity account. How do I get access to the new features?
Oh, great question. So your account administrator within your organization would assign certain permissions to you depending on what your role is. To see who your account administrators are, you would go to the upper right-hand corner under your account and click on My Administrators, and that will show you everybody who has the ability to grant you various permissions to features.
Great, thanks, Barb. Lucas, I have a question here for you. Will you add the ability to upload medical records to attach to claims?
Yes, actually. So in the new direct messaging platform or function, there's the ability to do this. So what you need to do is you can just run a claim status request for that specific claim, and then initiate a direct message. And within there, you're allowed to attach the required medical documentation. Just a note though, you want to make sure that the request letter or cover letter is the first page in that attachment.
Great. And we've also got a few shout outs that people are very happy about the new direct messaging functionality. And I think that's a great way for a lot of you to ask questions specifically about work that you're working on currently. So if you haven't tried that out, definitely take a look at that, because it's a great way to get in touch and get answers in the secure environment. So Cinda, we have a question here for you. Can I use the portal to correct claims?
That's a great question. There's not a real-time option, but there is a replacement option if you go into the web portal and submit a claim. And when you do that, you go down halfway down the page to claim information, that you will see bill frequency, and there you will change that from an original claim to a replacement claim, and then a drop down will appear to enter that payer control number to put in the ICN/DCN and complete all the fields there and submit that, and that would be how you would do a claim correction within the web portal.
Perfect, thank you. So we got a bunch of new questions in here. Again, I encourage you to ask questions if you have. We still have a bit of time here left, so please enter those in the questions tab, and we'll get to as many as we can here today. Ryan, I've got a question for you here. Where do you look for the claim status?
Yeah, so for the status of a claim, if you're just trying to find out whether we got it and whether it's been like paid, denied, or if it's still in process, if you're just looking for that high of a level, best thing to do is the claim status tool. So again, if you don't have access, your primary account admin can set you up with access to that, but then you would, once you have access, you just go up to the top of your portal homepage, and then under claims, you'll see claim status. That's going to be your best bet in terms of finding out, is it paid, denied, in process. If you're looking for something beyond that, like if you're trying to find out adjustment reason codes or specific payment information, with that, your best bet's going to be the Remittance Viewer screen. So you can certainly still do claim status if you want to get like the claim number, or another option you have is to use that Remittance Viewer page. And then if you search by claim, you can even search just by subscriber information. So you have a couple options. I would say it just depends on how much detail you're looking for, but the claim status feature is probably going to be your best bet to start with.
And I think there's a follow-up question here. To that, is there a place to find a remit prior to July 2018 on Availity? Ryan?
Sure. So the July 2018 date is really just there as a that's for sure. Everything after July 2018 is out there. So when we switched over to Availity, we did try to load some historic data. So we try to go as far back as we could. I know there's stuff out there. There are some remits out there, I think all the way back to like January of 18, maybe even sooner. It was just that the load process wasn't super consistent in terms of the various kind of remits that you could get. So if you have something before July of 18, it might still be worth a search out there on the portal just for the heck of it to see if it's there. Just because there are definitely some from earlier than 18. If you don't see it out there, there wouldn't be a way to get it electronically through Availity, but our customer contact center can still help you out with that. You just want to give them a call, and then they can make sure that that gets out to you.
Great, thanks, Ryan. Barb, I got a question here for you. How do you find forwarding balances?
So on a remit that references a forwarding balance, it will give you a reference number. And even though it may not look like a check number, it usually begins with a C. You can still search on that reference number, and that will take you back to the original remit that recovery was made on.
Perfect. And I'm going to follow up with one more question to you, Barb. On patient benefits, at some point will we get to see if they have telehealth as an option or as a benefit on their plan?
I believe we are working on that. I will have to follow up on that. If you, we'll get the participant's email address. I will follow up on that.
Yeah, and we do have your emails as they come in on these questions. So if we need to follow up on some, we will mark those and get back to you with answers on these questions.
Thank you.
Lucas, I have a question here. How do I get more payers in the authorizations request?
By more payers, does that mean other payers that aren't us? I don't know if maybe we can't ask follow-ups, but
we may need to get more clarity on that question, so I can go on to the next one here. Is there a way for this to tell us exactly which third-party entity would handle the prior authorization if it cannot go through Availity? So it's kind of a longer question there. So I don't know if Lucas or Ryan, you could jump in on that one.
Yeah, I was going to say, Ryan, unless you have a succinct answer, that might be a good one to follow up on.
Yeah, there won't be. So if it is one of those that's not, that Availity is not the one, I guess, trying to kind of assume what I think they mean by that for this, and even for that previous prior auth question. If you have a prior auth for a Blues member, but it's not North Dakota, Availity will route it to the proper state. It does have to be a Blue Cross Blue Shield member, though. So, for example, if you have a member from Blue Cross of Minnesota, or even let's take it further away from there, if you have a Blue Cross of Texas member you need to do a prior auth for, you can still start it in Availity as normal. And then Availity actually on that, like Barb had mentioned, on that very first screen of the wizard when it validates the member, it also looks at what state that member's from. And if it's an out-of-state Blue, Availity will route you to the screen. So it's got that. However, if it's not a Blue plan, then it gets a little trickier. You might run into some errors with the member. If it has to be a different entity outside of a Blue plan, it won't tell you right now in this moment exactly what entity that is, but yeah, hopefully that covered it. But if not, if that doesn't answer that question, we can certainly reach out for more detail. But at a high level, that's kind of the summary of other payers with prior auth.
Yeah, and Ryan, I don't know if we want to talk a little bit about, if you have questions specific about claims or work that you're doing, you can reach out. I pulled up the business operations team here. Ryan Slominski is speaking with us now, and he's the team lead. And if you have any questions, you can reach out to him. But I don't know if you want to chat quickly about portal questions about Availity as far as reaching out to them as well, Ryan, if you want to touch on that.
Certainly, yeah. So as Jason mentioned, you can feel free to reach out to me if you'd like. I know you guys all are here because you got an invite, so my direct address is on that. We are working on getting a better team group public email address you guys can reach out to, and once that's set up, we'll let all you guys know. But I think the key thing to remember here is, in terms of who to reach out to for Availity assistance, Availity Client Services is really going to be the best place. The reason being, they can actually kind of see transactions that you run. So if you try to do something in the portal and it fails, they can usually see it right away. They can also walk you through things on the portal. So long story short, they can see quite a bit more and they have access. So I would start with Availity Client Services if you're ever trying to navigate and you're wondering why something's not working, or if you're trying to set up access to something and you are the primary account admin. However, as Jason mentioned, if there are questions on specifically what we're talking about today, you can always feel free to reach out to me. And then, like I said, once we get that team address set up, we'll communicate that to everyone as well. But yeah, if there's anything we talked about today that you'd like to follow up on additionally, feel free to reach out.
Perfect. Thank you, Ryan. Cinda, I have a question for you here. Are we able to submit ABA pre-authorization via the portal?
That I think I don't have the answer to, so we may need to actually follow up on that one also.
Okay, and that's fine. And on a lot of these, we have all your questions and your email addresses, so we will follow up with these if we weren't able to answer them today. So, Cinda, is there a coordination of benefits area like there was in Thor?
So it's not the same as Thor. What are they looking for exactly? Do we have a little bit more information on this one?
I do not. It just said I think there was a feature probably in Thor that was coordination of benefits area, and they're just wondering if there's something similar to that in Availity. So
I think maybe we could follow up on this one too if we had a little more information. Thank you.
Okay. I'll go back to Ryan here. Do providers need to sign up for a particular service to get medical records requests via Availity?
Yeah, great question. So there's not a particular, well, it's just a matter of that direct messaging feature that Lucas went over in our slideshow. So if you're looking to attach medical records to claims to get them to reprocess, the service you'd want to sign up for would be that direct messaging. So if you're the primary account admin, you'd want to go ahead and add that. If you aren't, you'd want to reach out to your primary account admin, but that's definitely going to be your best bet right now is to get connected, get signed up for that direct messaging service, and then once you are, that claim status and attachment feature will be a great tool for you.
And Ryan, another question here, just as a follow-up, that was in your area. Where can we find our account ID in Availity?
Yeah, it's a good question too. So when you sign into Availity and you get to the home page, on the right side of the screen, you can click My Account Information. And then if you click into that and go into your account or your organization, either one really, you do have to click into that next screen. But when that screen comes up, off to the right of the screen, you're going to see the name of your organization, and then it'll say customer ID. So it should be it's usually like a 5 or 6 digit number, depending on how long you've been an Availity customer. But no, that's a great question. That ID, as Lucas mentioned, that's the one to have handy when you reach out to Availity. So that would be how you get it.
Great. And Lucas, I'm going to skip to you here because this is around direct messaging. Can I request an appeal status update with direct messaging?
Yes, you can request a status update, but you can't do an original appeal.
Okay, so you can, yeah, you can do an update, but not an original appeal. I think that's what. So Barb, is there a way to just print out a remittance instead of having to download it? So it sounds like there's just a download feature of the remittance, but is there a way to just print it right from the Availity portal?
You would download it as a PDF, and then it can be printed.
Okay, so you do have to download the PDF and then print that from there. So
Yes.
okay, thank you, Barb. So I'm going to go back up to Ryan here. This is a little bit longer question. If medical records are requested and we don't have the letter, can we request which records are needed via direct message? Also, if no letter, do we attach the medical records request form?
Yeah, so you can, if you receive a request for records, but you're not sure which one it is, the best way to use the direct messaging feature for that, you certainly can. What I would advise doing is running a claim status for it and then clicking that message this payer box and then just mentioning that you received the request for records and you're wondering specifically what they're looking for. If you have any kind of a number or an ID number, you know, that came in the request, that'll probably help the agent out that responds to your inquiry. But yeah, you can certainly send a question. I mean, to be totally honest, you can send pretty much any kind of claim question you could think of through direct messaging. And so this would definitely be one. And then when they tell you what records they're looking for, to answer the question about the letter, yeah, if you don't, whether you received the request letter, whatever that form of the request was, that you just want to make sure is the first page on that. And even if you misplaced that or lose track of it or don't know where it is, you can request that even in the direct message too. So yeah, pretty much any kind of claim question you can think of outside of, as Lucas mentioned, outside of like starting an appeal, you can request the status of an appeal. But other than that, pretty much any kind of claim question you can think of, direct messaging can handle that for you.
Great, thanks, Ryan. Barb, I have a question here. Can we void a claim through the portal?
So we cannot do voids through the portal. We can just do a claim replacement.
Okay. Lucas, how do we attach a primary EOB to a secondary claim?
Primary EOB to a secondary claim. You can't actually attach the EOB. There's some designated fields where you can enter the secondary info, but you can't attach.
Okay.
And I would just add that if your software can't support that, you can do the claim entry in Availity. If you just log into the portal and do an actual claim entry, there's fields on there for the secondary information.
Great, thanks, Lucas. Cinda, I have a question here. This is a little longer one again. Do we still need to submit the Blue Cross Blue Shield North Dakota form when uploading our clinical documentation for pre-authorization request? And there's a little bit, or does the information we enter within Availity to initiate the authorization request make the form unnecessary?
No, you do not need to do that for pre-auth.
Okay. Ryan, another question here. Will there be additional information regarding mental and behavioral health benefits available per patient's plan? And then they follow up with to include whether copay or deductible coinsurance.
Yeah, absolutely. So in terms of just copay deductible coinsurance in general, you can find that by doing the general eligibility and benefit inquiry. That'll give you the copay deductible coinsurance. That kind of stuff is in the basic results. But what you could also do then, in terms of the question about behavioral health, is you can take advantage of that service type dropdown, and that would be a great instance in which you'd want to use that to designate that you're looking for that type of a service when you run your E&B. So again, when you're on that home page, right in the middle of the screen when it mentions service type and it defaults to just the general, if you go to that drop down and enter in, that you're looking for mental or behavioral health, it'll bring back any extra information that we have. But yeah.
Perfect. Barb, I have a question here for you. Regarding searching for forwarding balance reference numbers, where do we search? Is it in the Remit Viewer?
Oh, yes, I'm sorry. In the Remit Viewer, you will search for that reference number
Okay.
as a check number, the check summary.
Okay. Cinda, we have a question here. And the person asks, we have not been getting the medical records request letters. How do I fix that issue?
That one we're going to have to follow up on. So if
Okay.
you can just forward that information, that'd be great.
Okay. Perfect. So Cinda, maybe you can answer this one. What is the best way to bill flu shots and go and edit something once submitted if it needs correcting?
So that again would be if you need to correct a claim, it would be your replacement. So if you've already sent the original claim and you figure out that you need to correct something, that's when you do the replacement claim.
Okay, perfect. And I don't know if we could answer the best way to bill flu shots. Would you have an answer for that, or would you need to follow up on that as well, Cinda?
I think flu shots depend on the actual provider's software, so they may or may not be able to submit those. So they may need to talk to their vendor. But we can also follow up if there's, additional questions.
Perfect. Ryan, I'm going to go back to you. We only have a few minutes left here, everybody. So if we did not get to your question, be assured that we will follow up with these. Ryan and the team will get back to you. We have your questions in your emails. And again, just to note that this webinar is recorded. So if you want to refer back to something at any point in time, the link will be available where you can watch this on YouTube later as we go through this. So Ryan, I have a question here for you. If we receive an error message when attempting to upload clinical documentation within Availity, is there a way that clinicals can be faxed in for review? And then they follow up, is there a cover sheet or specific information that needs to be provided in order to link fax clinicals to the Availity request?
Yeah, that is a good question. We've gotten that a couple of times. So if you submit a prior auth electronically and you run into an error when you're trying to upload that attachment, if you try to fax that in, it may not necessarily connect. So I wouldn't rely on that as a default. Really, I think if you're getting any kind of an error when you try to upload that clinical documentation, if you can please let us know. If you can, you can even reach out to me directly. As we mentioned, we got my email address there. We had heard of that a little while back. For the most part, we haven't seen that be an issue. But if you are running into problems like more than once, when you try to upload that clinical. If you can let me know, we can follow up with you on that. But to answer the question about if you send it electronically, will a fax connect to it? It doesn't connect to it automatically. That's not to say it absolutely can't. I mean, you can fax it into us, and we can try to do that manually for you, but it won't be nearly as efficient. So I think the best answer to that question is if you're running into errors when you're trying to upload, if you can let me know, reach out to me, or to be totally honest, I can follow up with you. I'm sure Jordan has, or Jason has the answer for that question, and we can try to sort that out, because we want to make sure that you're able to efficiently do everything from start to finish electronically, and that you're able to see that response come back in your dashboard as well.
I think you're on mute.
Yeah, Jason, you might be on mute if you're.
You were right. I am on mute, and it was a really good question too, Ryan. So the person asked, is there a specific web browser that these tools function best on? So there was another Blues plan. They recommend using Google Chrome when doing prior authorizations in Availity. Do you guys recommend Chrome or another web browser that's best suited?
Yeah, your best bets are going to be Chrome or Firefox.
Okay.
That's not to say it won't work with IE or with Edge or something else, but I would try Chrome and Firefox initially.
Okay, very good, very good. And I think there is probably, I just will let you know that we are running out of time here. We are at 11:14. So we're probably going to end the webinar here shortly, but I just wanted to thank everybody for participating today and all the great questions. There is about a dozen questions that we did not get to, and some of them are very specific. So Ryan, Barb, Cinda, and Lucas will be triaging these questions and getting answers back to you as follow-ups on this. As Ryan had said, for any technical issues with the portal itself and its functionality, reaching right out to the Availity team is probably your best first option. If there's specific claim or other information that you're working on, you can certainly reach out to Ryan as well if you have very specific questions, especially when we're talking PHI or things like that, which we can't cover in a webinar like today. So without further ado, I guess I'm going to end the webinar for today. Thank you all for participating, and look for the link of that survey that's going to follow this. As you close GoToWebinar, and then in the follow-up email, you'll get a link to that survey as well. And then as a follow-up, we will be sending this out as a link with the full recorded session, so you can watch it on YouTube and go back and maybe catch anything that you may have missed that we covered today. Thanks to all the presenters, and thank you all, and you have a great day. Until next time.